Welcome back to In the Know. Again, I'm Dr. Justin Davis. This is my assistant with Florida Marijuana Doctors. And we had so many questions and so much information in the last segment, we wanted to bring you a little bit more of what we had previously spoken about to really try to help you out to be as knowledgeable as possible.
What happens if there's a patient who has takes a controlled medication and they don't list it on their intake form?
Sure. Well, as part of the process of screening applicants and seeing patients, there's something called E-Force that the state of Florida provides, and it's also actually mandatory that physicians check that. And that lists all of the controlled substances that any individual has filled in the state of Florida. And so there's really no sense in hiding information because the physician's going to see it anyways. And people have legitimate reasons. Obviously, physicians have prescribed these medicines, and so there are for legitimate reasons. And I think it actually, the more honest you are, the more it helps you in the process of getting a medical marijuana order.
Why would you recommend either oil or flower? Is there a preference for one or the other?
Well, that's a complicated question, and rather than get into necessarily the details of that, what I'll say is what you had touched on earlier is that it's really more complex than the average medication. Because the average medication, let's say that somebody's taking an antidepressant or an anti-anxiety medicine, and when you go to see a physician, we prescribe this medication. We say, take this dose this many times a day. With marijuana, there's just so many formulations, so many ways to use it, so many strains or subtypes. There's flower versus the oil concentrates. How do you take it? What doses do you take? And a lot of this has to be self-guided. And the dispensaries, of course, they have people there that can also help you. But I always tell people, when you go into this, you have to expect that there's going to be a big learning curve. It may be months, it may be at least 3 months for you to really understand how marijuana is going to work for you. It's ultra critical that you keep a good log, and we provide you with not only a paper log, but some links to some apps. If you're more of an app person or more of a paper person, we give you either way, but that you keep track of what you're using so that you can really determine how this is going to be best used for you as a medication. And that's part of the process. And at our practice, we're very hands-on. We provide a lot of follow-up and education for people because I think a lot of this is about education.
I've heard you tell patients to start low and slow.
Yes, that is a great point, and always, particularly for people that haven't used marijuana in the past or haven't used it in a long time or aren't used to it, it's very important that you start with low doses. You're looking at this as a long-term treatment, right? So you don't need to go for the gusto in the beginning. You want to start with nice low doses and make sure that you don't have any adverse reactions. And remember, this is a medicine that you're looking at. You want to be on this medicine probably for a very long time. This is a chronic condition that we're treating. And so there's no sense in overdoing it. You want to try to get the lowest dose that's going to be the most effective and pace yourself.
So when you write the order, you say up to 45 milligrams a day, up to that much. So you're expecting to start with 1 or 2 milligrams and 5 milligrams and titrate up?
Yes, so always when I'm writing an order, because it's a 7-month order, or it can be up to a 7-month order depending upon the physician's discretion, we're writing it for the maximum potential that someone might take in that time frame. But in reality, yes, someone may never reach that potential, and yes, usually I would like them to start with a much lower dose, not necessarily what I'm actually writing, which may be somewhat arbitrary.
Do they develop tolerances?
Well, people can develop a tolerance, and that's something that we screen for, we keep an eye on, and it's also another reason why it's important to start with lower doses rather than taking very high doses, because you're much less likely to develop any kind of tolerance if you're taking a low dose, and if you're also taking it as a medicine as opposed to just sort of using it without thinking about it just, sort of recreationally. It's better to really be conscious of what you're using and why you're using it, and keep it as a medicine. And I think that helps tremendously with that.
I've heard you tell people to take holidays from it.
Well, that's another way to avoid gaining tolerance, is for people to take holidays, meaning that, maybe on the marijuana Sabbath, you use it for 6 days, and on the seventh day you rest, and so you don't use any THC products for that day of the week. And that's an example. There's different ways to do it, but that's an example of how one might help to also have less of a chance of developing tolerance, and really make sure that the marijuana is going to be effective for them in the long term.
So is there a cap on the amount of milligrams for, say, somebody who has a non-life-threatening condition and somebody who is in stage 4, say? Is there a different cap for what you would order for them?
Yes, there are some state limitations on how much can be ordered, and it can differ by conditions. So someone that's terminally ill and imminently, maybe passing away, there may not be a cap for that person, whereas for someone that we're looking at, in the long term, they're going to be using this, we'll set different limits. And there are sometimes there's conditions that, there might be exceptions that need to be made, and we'll register with the state and ask for an exception for a particular reason. But in general, yes, we do have limitations on how much we can prescribe. But for the average person, it's a pretty generous limit. Thank you again for joining us on In the Know for the second segment of how to get your marijuana card and related topics. This was great for us, and hopefully it'll be informative for you, and you'll enjoy it as much as we enjoyed being here.
Thanks so much for having me again. I've really enjoyed talking with Dr. Davis and you, and I look forward to talking to you again.